Hello students, today we will discuss about first unit of psychology, introduction of psychology. Under this chapter, there are four main topics: introduction, branches of psychology, relevance to psychology to nursing, and method of psychology. So first we will discuss about introduction of psychology. The word psychology is derived from two Greek words psyche and logos, which means soul and study of. Hence, the
earliest definition of psychology was that it is the study of soul or spirit. Later on, the dark mind
replaced the soul, and psychology began to be regarded as the study of individual mind or mental process. Well, this definition was given up as unsatisfactory because the mind is an object does not exist. What exists is only the brain. In other words, the mind is a function of the brain which can be studied in terms of a human behavior or activities. When the functions, therefore, psychology is not regarded as the scientific study of human behavior and mental process. After that, branches of psychology. So psychology has been basically divided into few branches which are studied for various aspects of behavior. The scope of psychology is very wide, hence it has been classified into many special branches for the purpose of detailed study and to maintain its accuracy. The basic two branches of psychology are pure psychology and applied psychology. Under this pure psychology, there are certain branches like general psychology, comparative and animal psychology, physiological psychology, developmental psychology, abnormal psychology, social psychology, experimental psychology, etc. And applied psychology. Under this applied psychology, there are also some sub branches like clinical psychology, neuropsychology, health psychology, community educational psychology, industrial psychology, consumer psychology, counseling psychology, sports psychology, health psychology, legal psychology, and military psychology. So now we have briefly described about the sub-branches of psychology. General psychology. It deals with principle of psychology. It describes the universal characteristic of human being. It is concerned with normal human behavior in relation to higher mental process like sensation, perception, attitude, memory, learning, etc. A good foundation of general psychology is necessary to understand the theoretical and applied aspect of psychology. Number 2. Comparative and animal psychology. This branch of psychology deals with comparison and contrast of animal behavior with its different species. Third one, physiological psychology. This psychology deals with structure and function of sense organ, muscles and nerve. It gives importance on the function of the organ and its reference on human behavior. Physical factors that affect the nervous system includes heredity, metabolism, hormones, disease, drugs, injection, diet, etc. Fourth one, developmental psychology. It studied about different developmental factors during the entire lifespan of an individual. Infants, tolerance, preschooler, scholar, children, adolescents, adulthood, old age. It is also concerned with the nurture of an individual, affecting due to various relation and also due to development stage. Abnormal psychology. It deals with psychopathology and abnormal behavior of an individual. This branch of psychology covers a broad range of disorders like depression, anxiety, obsessive compulsive disorder, schizophrenia, mania, etc. And also its diagnosis, cognition, treatment and management. Social psychology. It deals with behavior of an individual influenced by other individuals. It also deals with group phenomena, public opinion, propagate and crowded behavior, etc. Experimental psychology. It is concerned with application of rules and procedures in the study of psychoanalytic phenomena. The experiment was carried out in terms of psychological test in the psychological laboratory by psychologists under controlled conditions in order to establish hypothesis and illustrate law of experiment. So now we are starting with the sub-branches of applied psychology. Clinical psychology. It is related to scientific study of human behavior in relation to diagnosis, treatment of people who have psychological problem and have difficulties in adjusting to self and their environment. Clinical psychologist deals with the abnormal as well as normal behavior of individuals. Neuropsychology. It is branch of psychology and neurology that aim at understanding how structure and function of brain are related to specific psychological problem. Counseling psychology. It focuses on helping individuals to dissolve their personal and social issues related to their work, school and family. It is more of normal development issue and stress of life. Health psychology. It is the application of psychological theories and researches to health, illness and health care. While clinical psychologists focus on mental health and neurological illness, health psychology is considered with psychology of wider range of health and related behavior. Health psychologists help people to stay healthy by assisting them overing to good and healthy habits, disease treatment, resistment and other factors which even is required to keep oneself healthy both psychologically and mentally. Community psychology. It applies psychological theories and research findings to solve social problems in order to improve the qualities of life of an individual and community at large. Educational psychology. It deals with understanding the process of teaching and learning that takes place within the formal environment. Example, school, college, universities, and developing the ways of improving those methods. The focus on the classroom management, students' discipline, punctuality, method of teaching and also method applied for teaching differently able children. mental retarded. Industrial psychology. It is concerned with people at work. It is also known as personal psychology, where the psychologist deals with individual. Psychologist deals with investigating issues such as how to make job more rewarding, interesting, and how to improve workers' performance for the benefit to the company, etc. Consumer psychology. It is the study of how people relate to products and serve that they purchase or use. Consumer psychologists examine the performance of customer or habit of various consumer groups. Example: hotels, hospital, cosmetic products, eatable item, etc. Sports. It is one new concept in the field of psychology, which studies about the psychological and mental factors that influence and are influenced by participation and performance of sport personnel. Legal psychology. It involves application of study or practice of psychology of legal instructions and those who come in contact with law. School psychology. It applied the principle of clinical psychology as well as educational psychology to the diagnosis and treatment of behavioral disorders, learning problems of children and adolescents. School psychology provides counseling, they instruct and mentor students with problems and work with parents, teachers, and community alerts. Military psychology. It includes research, assessment, and treatment of military life. It also involves the application of psychology and its theory to work towards understanding and predicting behavior related to military operations that may affect military personnel, their families during the war and crisis. Okay, after that we are starting a new topic, relevance of psychology to nursing. That means the relationship between psychologists and nursing. It is important for nurses to be exposed to the general principle of psychology, to understand cognition, affection, and connection aspects behavior. Nurses always work with people of various categories and various illness that is necessary for them to understand equal. The study of psychology will be the great use of student nurse for the following reasons. Number 1. Psychology will enable the nurse to understand herself. This implies an understanding of her own motives, desire, emotion, perception, attitude, ambition, etc. Psychology also will help her understand how to factor like our ambition, ideas, or desire work with and also for other people, to reaction of her family, attitude of her teacher towards her first performance, etc., towards her profession, etc. Again, psychology will help nurse to assess her ability, weakness, and her reaction to others and various others. Psychology helps nurses to understand other people. A nurse has to work, study, and live with other nurses, doctors, patients, and their families. With her scientific knowledge of human nature, she will be in a position to understand them better, and thus achieve great success in the interpersonal relationship. Number 3. The study of psychology will help the nurse gain better understanding to the communication process. This will enable her to communicate effectively with patients and their families. Patients often find it easier to discuss and communicate with nurse, doctor, and they are able to have a less formal relationship with them. Number 4. Nurse attitude towards her work affect the nurse-patient relationship and illness. A positive, supportive nurse-patient relationship is believed to be empower the patient and enhance its pre-achieved well-being and health. Poor patient satisfaction has been linked to poor complaint to treatment regimen, and consequently they are poor outcome. A positive attitude boosts the immune system and contribute to psyche health and recover. Psychological principle will help nurse to understand emotion and physical need of the patient. Number 5. Study of psychology will help the nurses to appropriate the need of change of environment or surrounding. It will be hard in making of the environment, which is sometimes necessary for better alignment, happens, and well-being. For example, a child who is completely denied from effective role of the patient may present her better when undesired to the care of fosters. Study of psychology will enable to nurse to identify the factors which affect the way patient could cope with illness, pure or loose. Number 7. It will help nurse to understand the influence of lifestyle on health and factors that motivate health selected behavior like smoking, exercising, etc. Well, after that, a new topic will start. Method of psychology. Psychology is the systematic and scientific study of human behavior. It has its special tools and procedures. These procedures help us to gather and organize the subject matter or essential factor about it. It is called method. There are some of the methods as mentioned below. Number 1. Introspection or self-observation method. Introspection is a method which is made for looking into self, looking into working of our own mind and reporting what we find there. It is a method of self-observation in where An individual studies and reports about his or her own mental status. Number 2. Observation method. This method is called method of objective observation and opposed to introspection. Here the behavior of an individual is observed by someone else observed by someone else other than the person himself. Here affect the observation as recorded and analyzed. Number 3. Experimental method. This is a method of objective observation under controlled conditions. The use of this method has raised psychology to the status of experimental science like physics, chemistry, biology, and physiology. The experimental method has used to study various sensory, cognition, and memory process. Every experimentation needs an experimenter who performed the experiment, the subject on whom it is performed, a question for putting into test. Number 4. Clinical or case history method. This is a challenging method of studying behavior. The use by clinical psychologists, child guidance clinic or mental hygienic clinical allied studies, industries, school, college, etc. We use this method when we want to understand the cause and source of people fear, anxieties, worries, obsession, their personal, occasional, and social maladjustment. The method used here are case history, the interviews, nice to home, visit to home schools, and physiological testing. Survey method. Survey is a technique for gathering information from a large number of population. The survey method asks for representative sample of people. The same questions about a particular attitude, opinion, values, and belief. If the sample is truly representative, this allows the realization of the result to the population from which the samples are collected. Survey can be divided into two broad categories, that is the questionnaire method and interview method. Number 6. Genetic and developmental method. This method seeks to find out the cause of complicated behavior from a simple beginning. It assumes that full appreciation of such behavior pattern of an individual requires its study from childhood, because this simple behavior pattern grows into more complex complex gradually as the individual grows older. That is, if we are trusted in understanding the learning behavior of an individual, we should begin study in since his or her childhood, pre-adolescence, adolescence, adulthood, old age. These methods seek to answer the question as how we become what we inherit, how the inheritance is modified in childhood, adolescence, in adulthood. Number 7. Testing method. Psychology applies scientific tests like other science subjects which are known as psychometric tests. There are different types of psychometric tests which are applied into measure different higher functions like intelligence, aptitude, personality, achievements, unconscious feeling and deaths, etc. To name of few tests following are: number 1, 60 personality factor test. Number 2, Rorschach ink blot test. Number 3, draw a person test. Number 4, MMPI Minnesota multi-phasic personality inventor. Number 5, Children's A perception test, CAT. Number 6, Muller-Lyer illusion test, etc. Well, thank you so much guys for watching this video. With this I am ending this video. I am just sharing you small notes that this is important for our knowledge and exam also. So please study everyone and prepare yourself as a good note. Thank you.